Hello, my name is Samantha Loy. I'm a psychiatrist at the Royal Melbourne Hospital. I'm an old age psychiatrist and a neuropsychiatrist, and I also work as an academic at the University of Melbourne. The main thing, I guess, for me as a psychiatrist, I completed 6 years of medical school training. So I'm qualified as a medical doctor, and I've done further study in psychiatry and then further specialisation. So all up, I've done probably almost 12 years of study to be a psychiatrist. So I guess one of the main differences for me, or the way I see it, is that not only can I prescribe medications, which some people see might be the biggest difference, is that I have an understanding of how the human body works, the interactions of medications and other types of therapies on the brain and how it might affect a person. Now, one of my roles is to hold the risk of a person in terms of their mental health and their risk to themselves and others. I've also had training in therapies as well, so not just pharmacological therapies, but also how to do things like CBT and other types of psychotherapy and what they might do and affect the patient or the person I see in front of me. So I guess our core business is really to improve the mental health of our patients, of who we see, and try to provide a way to keep them functioning well in the community and improve their quality of life. And that can mean many things, not just medications, for example, and prescribing therapies and other types of activities or things like that, but how they might fit within the system, and the other needs they might have, and try to see how they would be in terms of priority. So, for example, if someone is homeless, the priority would be getting them somewhere safe to live, as opposed to we're going to put you straight to have some medication therapy. Having a safe place to live and have food and water and clean clothing might be the start. So the core values would be looking at mental health in a really holistic range and scope. As a public psychiatrist who work in the public hospital, we have quite a large scope of practice. I would say that the scope of practice will be primarily to assess risk. People come into hospital when they are experiencing adverse mental health, and some of the things we would triage would be at how high risk they are, and that might determine of whether they're able to be admitted to hospital or not, or whether they're being able to be managed by a community team. And so those are the two, I guess, very broad scope of practice, whether it's within a hospital setting, where it might be a more acute scenario, as opposed to in the community, where it might be more stabilisation with a mental state, whether it's looking at medications, looking at other services and trying to link people into other aspects of the community, and then seeing what other things people might need. So is it about other support services? Is it about their physical health? It's about other support, such as the National Disability Insurance Scheme, which can help a lot, engaging families, trying to improve mental health literacy and advocacy. So it's narrowing the sense of it's more inpatient versus outpatient, but I think broadly it's about how we engage in advocacy and improving mental health on a much more broader scale. And I think that's another very important part of our role as a public psychiatrist. So there's been a couple of really important factors which I think have really changed psychiatry and impacting on us and in the workforce. One of the biggest things I'd like to talk about is the impact of COVID-19. As you know, Melbourne was the most locked down city and really affected people in the community in terms of their work, their relationships and ability to go out. And from that perspective, many people who may have had some mental health difficulties, who might have been able to access a GP or psychologist or other help, they wouldn't have been able to do so. And hence the impact of that has now led to people trying to access mental health services publicly because they're now in crisis. And so that has then impacted on our waiting lists and the ability of us to actually see people who would have been able to more easily be managed in a community. And I think we're still seeing the mental health impact of COVID-19 in many years to come, particularly on children and young people. So that's one important aspect. The second important aspect, which is, I think, quite different, is that we have some improved mental health literacy in some conditions and our understanding of how that might impact people. And the examples I give for those would be neurodiversity. And so even in the past year, there's been exponential growth and understanding and realization of the impact of neurodiversity on people and how they communicate, how they might access support services, and how it's really important that we do an assessment of neurodiversity in all people. And similarly, along with that, we have really good advances now in trauma-informed care. So really understanding the effect of trauma for people in their youth, for example, in their childhood, how that can affect their mental health and their capacity to support and access services has really been really important. And I would like to note that organisations such as Beyond Blue have really improved the community's literacy on conditions, very high prevalent conditions such as anxiety and depression. So people are now more likely to seek help, and also being able to reduce the stigma. If people are depressed or feeling low, hopefully they can now think about accessing help so they feel a bit better. I think working with a multidisciplinary team is crucial to be able to really look at all aspects of someone's functioning and quality of life for some of a mental health condition or psychiatric condition. As a psychiatrist, I might be okay at, for example, doing therapies and obviously very good at prescribing medications, but each person of the MDT has a really important role to play and expertise in trying to improve outcomes for people with psychiatric conditions. So I think that's fantastic to work with the team and to be able to share some of our expertise across disciplines. Can come with a bit of a cost or a bit of a some challenges. I think everyone comes with their own knowledge and their own personal experiences, and so hence people will have their own different opinions in how someone should be managed and what particular aspects of their care should be prioritised. And in the best case scenario, we would do all these things, but we know that in reality, you can't always do that. And as my job as a psychiatrist is trying to pick or choose which of these aspects should be taken as important, and what can we do practically for this person in the services and just limited finances that we might have. So that can be a challenge, trying to work that out and discuss and debate about these things. But I think it makes the team richer. And I also think it makes the care that someone receives better as well, having multiple perspectives and opinions. And we share the load in looking after the person, which I think is really important. So my 3 words, and I might add another one, is that being a psychiatrist means that you have the ability to really make a difference in someone's life in terms of improving their quality of life and their functioning. And I think that's very special to be able to do that and work within teams to be able to lead a team to do that. The second word would be challenging. As I've alluded to, there's many challenges within working as a psychiatrist in the public sector in terms of financial challenges, risk and acuity, and the changes of what we might see over the years. And so being able to move with the times and being flexible would be really important, but really nice and exciting. And thirdly, being a psychiatrist for me has been very intellectually stimulating. So not just as a psychiatrist do I sit and I think about practical things in improving someone's health and what that might look like, but my research background and the work I do as a neuropsychiatrist and old age psychiatrist has been extremely intellectually stimulating, thinking about projects and real life translational things which can improve someone's quality of life. And how it can make an impact has been really amazing and really adds another complementary aspect to my role as a psychiatrist.